I would like to start off by introducing our group. We are Team FOXTROT. My name is Irene Munarriz, and I'm joined by Louis, Bridget, Hugo, and Joe. Our presentation today is surrounding privacy laws and contact tracing regarding COVID-19 in the United States. Team Foxtrot's recommendation will attempt to amend the Stafford Act. The proposal calls for implementing the Information Management, Privacy, and Contact Tracing Law, otherwise referred to as the Impact Law. As the United States continues to see an increase in the number of COVID-19 cases, a paramount change must be seen at the federal level in terms of response operations. This law will finally introduce formal legislation surrounding contact tracing and infectious diseases. Contact tracing as a measure to contain the spread of coronavirus will facilitate in identifying which preventative measures have proven to be effective, such as quarantining. It can also determine when local governments can declare the reopening of malls, restaurants, entertainment areas, parks, and the like. Additionally, contact tracing identifies exactly who should actually be getting tested. And in fact, this will also address test supply shortages that various counties nationwide have experienced. Finally, the Impact Law calls for new positions to open up throughout the country, thus stimulating the economy and re-employing individuals who have lost their job due to this pandemic. The Impact Law will ensure HIPAA compliance. It will do so by protecting the infected person's identity when notifying the network of individuals who have been in contact with the infected person in question. Additionally, the Impact Law will not violate our right to privacy, which is alluded to in the Fourth Amendment. This law will serve as a progressive response tactic which effectively engages new technology for the sake of public health. I will now pass it on to Louis. Thank you.
Thank you, Irene. I'm Louis Subratz, and I'll be discussing history behind privacy laws. One of the many important freedoms that we have as citizens and residents in the United States of America is our right to privacy. The Fourth Amendment to the United States Constitution protects certain expectations of privacy, including a person's physical location as well as movement. In a decision of Carpenter versus the US, the Supreme Court considered how to apply the Fourth Amendment to historical cell phone records, as specifically to cell site location information, which provides a comprehensive chronicle of the user's past movements. As the number of COVID-19 cases in the United States grows, and by the way, correspondingly, the need for contact tracing, further discussion in the United States regarding privacy interests discussed in the decision of Carpenter and the need to quickly address a public health issue seems likely. As the Supreme Court noted in the Carpenter decision, cell phone tracking is near perfect surveillance that is remarkably easy, cheap, and efficient compared to traditional investigative tools. Understanding what these laws require in such situations and how they are applied will be critical both during the management of the COVID-19 virus and as authorities take stock in the months and years ahead. With social media, GPS surveillance, and smartphones, these advances in technology and privacy are at another crossroads in the history of the United States. The right to privacy is a notion that one's personal information is protected from public scrutiny. A former US Supreme Court justice from long ago, Louis Brandeis, called it the right to be left alone. In 1928, with the commercialization of the telephone and the invention of wiretapping, Supreme Court Justice Brandeis maintained in a dissenting opinion that Americans do have a constitutional right to privacy. The right to privacy often means the right to personal autonomy. While not overtly written in the US Constitution, some amendments provide some protections to privacy. For instance, the HIPAA, it protects a person's health information, and the Federal Trade Commission enforces the right to privacy in various privacy law policies and privacy statements. And these are two perfect examples of how most often the right to privacy is protected by statutory law. A few amendments in the Constitution have been successfully utilized in determining a right to personal autonomy. We, as presenters of this brief, believe in the right to privacy, but current contact tracing methods can be supported with technological assistance of global positioning system or GPS surveillance and smartphones. But we understand it could border on infringement of privacy of individuals. With the use of social media platforms such as Facebook, Instagram, and Twitter, for example, many have given up the right to be left alone. Therefore, public health officials are grappling with methods that would best find and notify people who may have been exposed to COVID-19 virus. And now I'd like to pass on over to Joe.
Thank you very much, Louis. For my portion of the presentation, I'll be talking about where we currently are with privacy laws and contact tracing and what we recommend as a group. What we're proposing doesn't currently exist, but it's much needed. We are proposing the Information Management, Privacy, and Contact Tracing Law. Impact. It will quite literally take an act of Congress to make this impact law pass, and that's why we're going to give you all the great information on this law. So it's a constitutional conundrum. How do we best provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our prosperity? How do we do that when we're addressing COVID-19? Well, let's go into it. So where are we now? A reckoning of privacy and public health. Right now, public health officials are grappling with how to find and best notify people who have been exposed to COVID-19. So contact tracing methods is what this is about. And contact tracing methods carry a multitude of privacy concerns, and they force a reckoning of how we, the people, weigh privacy and public health. How are we going to do this? We're grappling. We're not sure what's best. Governments and businesses are trying to make decisions and are considering how to best use technology. Let's talk about the past. In the past, public health officials have successfully relied upon old-fashioned, labor-intensive contact tracing methods. COVID-19 is much more complex. It has a longer incubation period. There's limited information about infected individuals, and asymptomatic carriers add to large-scale community spread. So here we are in the present. When we have large-scale community spread, we need a way to be able to stop that, to look at the hotspots, to understand what's going on and how we can get out in front of this and flatten the curve. How do we do it? With a quantum leap forward. We can harness technology. In just the past few months, there have been a multitude of contact tracing mobile apps that have become available. The mobile apps became available from a partnership through Google and Apple, and they became available from private businesses and companies. They all boil down to one fundamental premise, and that premise is using a smartphone to identify if and when we are in contact with another individual diagnosed with COVID-19, or if someone later becomes infected. If we're going to make this quantum leap, we have to address it at the federal level. Privacy laws must guarantee our rights, and our data will be protected and used appropriately. So our impact law that we're suggesting here will directly address the use of contact tracing. It will promote the general welfare and secure the blessings, liberty, and privacy of everyone. So to explain contact tracing, we're going to play a quick video.
Select your COVID weapon. Smartphone. Welcome to COVID Trail, slowing the spread.
The mission? To see if our smartphones can help us slow the spread of coronavirus once we can finally leave the house again.
Yeah, I've been stuck at home for too long playing video games. But the best way to understand the complicated world of contact tracing? With a controller.
Many states, app developers, and tech companies are working on contact tracing apps or exposure notification apps. Using either Bluetooth or location services on your phone, these apps aim to help us record who we've been in contact with. If people in close proximity report that they have COVID-19, we can then self-isolate to slow the spread. One of the main goals of these apps, help the human contact tracers. These public health officials ask infected patients where they've been and who they've interacted with. Then they track them down and tell them about their exposure to the virus and recommend quarantining. But can this really work? First, let me explain the technology. Then, how different real-world situations might play out. Then, we'll talk about how this all might be a long shot. Here's your first task. Download the contact tracing app. This is all opt-in. You aren't forced to turn it on if you don't want to. Two technologies can be used to track what people you come in contact with: Bluetooth and location. Bluetooth has been getting the most attention since Google and Apple have put their support behind it, teaming up to make a privacy-focused solution that works between iPhones and Android phones. Eventually, iOS and Android will be able to provide Bluetooth exposure notifications without you needing to download an app. A coffee shop nearby has reopened. Ready to see how Bluetooth works in this situation? So here we are. Your phone constantly broadcasts via Bluetooth a unique string of numbers. Think of it like unique tokens. Your phone is also listening for those tokens. If two phones are in close proximity for about 5 minutes or more, they receive each other's tokens and securely store it on the phone. As you go through your day and spend time near people, you collect other tokens, and others collect yours. Sadly, someone you were near tested positive for COVID-19. Once a public health authority has verified that, this person's app reflects this and uploads the tokens shared with other people near them. Then your app downloads tokens periodically to check for a match. If you have one of those tokens, the app will notify you that you were near someone who tested positive for COVID. Ready to see how location works in this situation? Some apps record a time-stamped list of everywhere you've been. This wouldn't be able to help with knowing who you were next to, but where you were. The trail of your movements can give context. If someone you were near tested positive for COVID later, they would share their location trail with contact tracers to help track down other people you may have come in contact with. If used alongside Bluetooth, it could also give context to those notifications.
There are a lot more privacy worries when it comes to location data. It makes sense. It can tie you to a specific place and time. In fact, Apple and Google say that app makers who want to take advantage of its Bluetooth platform cannot use location services.
But would you need both Bluetooth and location in real-world situations? If you breezed by someone in an aisle or even stood near someone for a few minutes, Bluetooth wouldn't capture it. Location data wouldn't capture your indoor location, but it would show you were at the store, which could be helpful to you or a contact tracer for retracing your steps. Plus, if multiple people tested positive in that area, public health authorities could mandate cleaning the location. If you were surrounded by dozens of people on a train or plane, Bluetooth tokens would do their thing. Location likely wouldn't be accurate or even picked up if you didn't have service. Bluetooth would do the trick if someone seated near you reports testing positive, although here location would also be helpful.
It seems like a pretty big long shot for all of that to work. First, people need to be okay with the privacy trade-offs.
Google and Apple's Bluetooth platform seems to be the most privacy-respecting choice, engineered to not reveal any personal information and for most of your info to stay on the phone. Each state will decide which app it releases and what technology is used. For instance, Utah's Healthy Together app not only uses location services to collect where you were, but also requires your name and phone number. The maker of the app says this is so health officials can get in touch with those who test positive. It says all data is deleted after 30 days. The Apple and Google Bluetooth technology should start to show up in apps in late May. The even bigger hurdle? That the vast majority of people need to participate for that Bluetooth app to work. If nobody on the train or coffee shop has the app, it won't do any good.
And then there's the chance of false positives and for the tech to just not work. Plus, we need widespread testing and people to be honest and report if they're sick.
So yes, your smartphone may be a weapon in this fight, and it may help those human contact tracers. But a lot has to happen for you to win the game. and truly slow the spread.
So with that video, we see a better understanding of this whole privacy and public health issue and how difficult it is. And that's why we're offering this recommendation, this guidance our team has put together. So we've talked about what the current laws are, why they're not working, the recommendation of our impact law, and where we're drawing now the recommendation from is from guidance that's already there. We're not doing this from scratch. We have a foundation that we can build on. And we'll do that by using the Federal Trade Commission's law, where they have the just-in-time laws, where their apps that are used must obtain users' affirmative express consent before accessing sensitive content, such as the geolocation that was discussed in the video. And then there's laws by the Equal Employment Opportunity Commission that state employers potentially could also require the use of a contact tracing app, provided that the app is used in a non-discriminatory manner. And then we also have HIPAA laws. HIPAA laws have changed recently for first responders. These laws state that if someone has been infected or exposed to COVID-19, we don't need the individual's HIPAA authorization in certain circumstances. We being first responders, because I myself am a first responder, we don't need those individuals' permission in certain circumstances, such as notifying public health authorities, like the public health of Miami-Dade County, and we can use that for the greater good for contact tracing. We would not divulge any privacy information. So that's really the crux of our foundation. The guidance that's out there is where we're going to go for the future as we propose our impact law. So now I'm going to turn this presentation over to Hugo.
Thank you, Joe. This link that we are currently pulling up encompasses the current global death rate of COVID-19 compared to other death rates. As you can see, COVID-19 down here is at 4 cases by January 8th, by 18th, and you'll see an exponential rise around March. The light blue bar at the bottom right above natural disasters, currently at 2,500 cases, February 25th. Here's the exponential spike. March 30th, 50,000 cases. April 16th, 175,000 cases. And by May, we have already surpassed more than 300,000 cases of global deaths caused by COVID-19. Totaling about almost 2 million global cases with 345,000 deaths. Now, there are multiple global models that have worked very efficiently for certain countries. For example, the South Korean model places great emphasis on immediately identifying and managing people that are close contact with suspected patients. The reason as to why it had worked for them was because in South Korea, they had used previous models for outbreaks. For example, the MERS outbreak that they went through in 2015 caused an insurmountable amount of deaths in South Korea, resulting in legislature change federally. And this approach that they developed was a stepwise approach in monitoring contacts with patients that have been detected with COVID-19. It is a web model in which it notifies individuals respectively based on their cell phone. So in order to avoid bias and improve information collection, as it was stated in the video that Joe had presented, the South Korean model uses medical facility records, a global positioning system based on their cell phones, card transaction records, and closed circuit television. This, however, is an issue given that both the culture and privacy laws between the US and South Korea differ greatly. South Koreans are willing and have given up their autonomy and allow the government to track them. However, HIPAA laws in the United States do not allow this to happen. unless in certain situations where first responders have been affected. Given the impact that MERS had in South Korea, the government made and enforced laws making disclosure of information mandatory. Current models in the US, these are the Apple, Google, and Microsoft are technology companies that are working to create applications that try to not violate HIPAA and privacy laws. But it has proven difficult given the fact that we have so many laws in regards to that. These companies are developing apps that combine exposure and basic location, but lack the cohesiveness of the South Korean model. The impact model that we are proposing will emphasize that current models available in the US, but also mold it to the Miami culture. Cultural characteristics are important, given the fact that each city in the United States is very different in the way that they act and the individuals that are living within them. We can use these cultural characteristics and focus on the particular community that has been impacted. Bluetooth technology can be used to notify and pinpoint exposed individuals. Now, just to reiterate the importance of enacting this law as best and as fast as we can, the top left portion, the infographic that you see up there, it is a mathematical model showing the prediction of COVID-19 cases in the state of Florida. In June 15th, it has been shown that almost every day there's more than 2,500 cases predicted. And by July 1st, we are expecting a rise to almost 6,000 plus cases. The bottom infographic that you're able to see down there, the solid red line indicates individuals of 65 years of age or more. The solid blue line, the dark blue line indicates 50 to 64 years of age. The light blue line indicates 18 to 49 years. As you can see, this infographic shows how many cases of hospitalization. It's the hospitalization rate per 100,000 individuals in the population. Individuals 65 years or more have more than almost 300 hospitalization rates per day. It just goes to show how important it is that we enact this information to be able to track the individuals that have been impacted by COVID-19. And with that being said, I'd like to hand it over to Bridget so she can recap and conclude our PowerPoint presentation.
Thank you, Hugo. First, I'd like to re-say what we've already said in our presentation on the fact that current laws do not allow companies to disclose private information. Vital information, in fact, necessary for the public health of our community and the community of the United States in general. This puts a great stress on our first responders because if you can look to your right, you can see that the cases among the healthcare practitioners is over 84,000. And of those 84,000 cases, there have been 465 deaths, including but not limited to first responders. The current laws don't specify how information is disclosed, and with this impact law, we will be able to better help the community itself become educated on how their information will be used and how their information will be protected. Regarding funding, right now, the availability of funding for supporting contact tracing in the United States has been confirmed and is only awaiting President Trump's approval for the release of $8 billion unutilized funds. The Center for Disease Control and Prevention, CDC, has yet to be awarded $4 billion for surveillance and contact tracing at the state and local levels, according to Senator Chuck Schumer and Senator Patty Murray, also at the tribal territories levels. Our funds will be utilized to perform system upgrades and data mining along with the implementation of COVID-19 tracking, specifically in an application as the video Joe presented earlier suggested would be a good idea. These funds, along with future anticipated funds, an estimated $4 billion in relief, will aid our team in development of proper techniques and results needed for successful COVID-19 tracking. Just to recap, current privacy laws in place don't give companies the right to disclose private and vital information. We've chosen to improve at the federal level an issue that we feel is important for not only our team, but for the entire community and the United States in general. Through the impact law, we know that the importance of ensuring that those who have come in contact with others that have been infected with COVID-19 stay informed and aware is top priority. We've discussed on how South Korea's model appeared after MERS, thanks to Hugo, which is specifically the Middle Eastern Respiratory Syndrome, and it was an outbreak back in 2015. Due to this outbreak, there were governmental changes to the legislature that allowed Korea to make changes in their response efforts. Their current model, along with other current models in other countries, show the effectiveness of the community and their willingness to give up their private information for the greater good of society. Are there any questions?